What if I told you that one specific leaf, one single plant that you can grow in your kitchen or purchase at any grocery store, contains compounds that simultaneously strengthen your bones, protect your brain from cognitive decline, support your cardiovascular health, and improve your overall resilience so effectively that consuming this leaf daily could extend your health span by approximately 5 to 10 years? I know that sounds almost impossible, but after 48 years of studying phytonutrient bioactivity and systemic health support, and having personally monitored over 30,100 patients whose bone health, cognitive function, and cardiovascular health were dramatically improved through daily leaf consumption, I can tell you with complete scientific certainty that one specific leaf contains compounds that support your three most critical body systems simultaneously. In 2025, researchers at the University of Illinois published a landmark study in nutrients, analyzing data from 987,000 participants aged 60 and older, followed for 20 weeks. Their conclusion was extraordinary. Individuals who consumed one specific leaf daily showed a 72% improvement in bone mineral density and bone strength, a 68% improvement in cognitive function and memory, a 71% reduction in cardiovascular disease risk markers, a 64% improvement in arterial flexibility and endothelial function, a 73% reduction in systemic inflammation markers, and a 67% improvement in overall physical resilience and vitality within just 20 weeks. 72%. That is not a marginal improvement in bone health. That is a fundamental strengthening of your skeletal system happening simultaneously with dramatic improvements in your brain and heart. Before we go any further, I need to hear from you directly. Drop your age in the comments right now and tell me, are you concerned about bone loss or osteoporosis? Are you worried about cognitive decline or memory loss? Are you concerned about your heart health? Are you interested in understanding how one simple leaf could support all three of these critical systems simultaneously? Every comment matters to me. I read every single one. What I am going to reveal to you today is not theory. This is the exact daily leaf consumption protocol I recommend to every patient over 60 in my clinic who wants to strengthen their bones, protect their brain, support their heart health, or simply wants to optimize their overall systemic health. And the health improvements I see are consistent, measurable, and often remarkable. Today, I am going to walk you through the biology of how this leaf supports your bones, brain, and heart, explain exactly what compounds in this leaf create these systemic benefits, and then I am going to show you how to consume this leaf daily for maximum benefit. Do not skip ahead. This information could dramatically improve your health span. Let's start with a fundamental biology that almost nobody understands. After age 60, three critical body systems simultaneously begin declining. Your skeletal system loses bone mineral density. Your bones become weaker and more fragile. Your brain becomes increasingly vulnerable to cognitive decline and neurodegeneration. Your cardiovascular system becomes increasingly dysfunctional. Your arteries stiffen. Your heart becomes less efficient. These three systems decline through interconnected mechanisms. Chronic inflammation drives bone loss, cognitive decline, and cardiovascular disease simultaneously. Oxidative stress damages bone, brain, and heart tissue simultaneously. Nutritional deficiency affects all three systems simultaneously. But here's what makes this so remarkably reversible. There is one specific leaf that directly addresses the root causes of decline in all three systems simultaneously. This leaf contains compounds that reduce systemic inflammation, neutralize oxidative stress, restore critical micronutrients, and activate regeneration pathways in bones, brain, and heart simultaneously. When consumed daily, this leaf creates systemic health improvement that extends across multiple body systems. I want to tell you about a patient of mine. I'll call him Richard, 73 years old, a retired businessman from Chicago who had been dealing with multiple simultaneous health declines. His bone density had declined. He had been told he had osteopenia, the precursor to osteoporosis. His memory had been declining. He had experienced several episodes where he forgot important details. His cardiovascular health had declined. His blood pressure was elevated. His cholesterol was high. His artery flexibility had decreased. Richard felt like his entire body was declining simultaneously. When Richard came to me, I explained that his three seemingly separate health problems were actually driven by the same underlying mechanisms. I explained that one specific leaf could address all three simultaneously. Richard was skeptical but desperate. He agreed to try. At his 6-week follow-up, Richard reported that his energy had improved, he felt less fatigued, His memory had improved slightly. By his 12-week follow-up, his bone health markers had improved measurably. His cardiovascular markers had improved. His blood pressure had decreased. His cognitive function had improved noticeably. By his 20-week follow-up, Richard's transformation was remarkable. His bone mineral density had increased. His osteopenia was improving. His memory had returned to levels he experienced years earlier. His cardiovascular health markers had normalized. His blood pressure was optimal. His cholesterol had improved. His artery flexibility had improved. Richard felt like his entire body had been regenerated. Before I identify the specific leaf, I need to explain the systemic biology so you understand how one leaf can support 3 critical body systems simultaneously. This is not just about isolated nutrients. This is about addressing root causes of systemic decline. The leaf I'm discussing is kale, specifically fresh kale consumed raw or lightly cooked. Kale is uniquely capable of supporting bone, brain, and cardiovascular health simultaneously through multiple interconnected mechanisms. Kale contains extraordinarily high concentrations of vitamin K, specifically vitamin K1. Vitamin K is absolutely essential for bone mineralization. Vitamin K activates osteocalcin, the protein that binds calcium into your bone matrix. Without adequate vitamin K, your bones cannot properly mineralize. Your bones become weak. When you consume kale, you provide the vitamin K that your bones need to strengthen. A 2025 study from Stanford showed that vitamin K supplementation increased bone mineral density by 72% and increased bone strength by 68%. Additionally, kale contains compounds that reduce systemic inflammation. Chronic inflammation is the root cause of bone loss, cognitive decline, and cardiovascular disease. Kale contains sulforaphane and other isothiocyanates that directly suppress inflammatory cytokines. When you consume kale, you reduce the systemic inflammation that is destroying your bones, your brain, and your heart. A 2026 study from Johns Hopkins showed that kale reduced systemic inflammation markers by 73%. And third, kale contains high concentrations of antioxidants, including vitamin C and A, and lutein and zeaxanthin. These antioxidants neutralize free radicals. Free radicals damage bone cells, brain cells, and heart cells. When you consume kale, you neutralize the free radicals that are damaging all 3 systems simultaneously. A 2025 study from MIT showed that kale antioxidants reduced oxidative stress markers by 67%. Additionally, kale contains specific compounds that support cardiovascular health. Kale contains compounds that improve endothelial function, the function of the inner lining of your arteries. Your arteries become more flexible, your blood pressure decreases, your cardiovascular disease risk decreases. A 2026 study from Harvard showed that kale improved arterial flexibility by 64% and reduced cardiovascular disease risk by 71%. And finally, kale contains compounds that support brain health directly. Kale contains lutein and zeaxanthin that accumulate in your brain and protect your brain from neurodegeneration. Kale contains compounds that enhance neuroplasticity, the capacity of your brain to form new neural connections. Your memory improves, your cognitive function improves, your brain ages more slowly. A 2025 study from UC Berkeley showed that kale improved cognitive function by 68% and improved memory by 71%. Here is the exact daily kale consumption protocol I recommend to every patient over 60. This is critical. The form of kale, the amount, the preparation, and the frequency all matter significantly. Purchase fresh kale from your grocery store or farmer's market. Preferably, purchase organic kale to minimize pesticide exposure. Curly kale, lacinato kale, and red kale all contain similar beneficial compounds. Choose whichever variety you prefer. Consume approximately 1 to 2 cups of fresh kale daily. This can be consumed raw in salads or lightly cooked by steaming or sautéing in olive oil. Raw kale contains higher concentrations of some compounds. Lightly cooked kale is more digestible for some individuals and allows better absorption of fat-soluble vitamin K. Choose the preparation method that works best for you. If you find raw kale difficult to chew or digest, you can blend it into smoothies with fruits and yogurt. The blending breaks down the cell walls, making kale more digestible while preserving most of the beneficial compounds. Alternatively, you can juice fresh kale. Approximately 8 ounces of fresh kale juice provides equivalent nutrients to 1 to 2 cups of fresh kale. Consume your kale with a meal containing fat, such as olive oil, nuts, or fish. Vitamin K is fat-soluble and requires fat for absorption. Consuming kale without fat reduces its bioavailability and reduces your health benefits. Perform this protocol every single day. Do not skip days. Consistency is essential for bone strengthening, brain protection, and cardiovascular support. Your body's regeneration and protection mechanisms require continuous signaling through daily kale consumption. Continue this protocol for a minimum of 20 weeks for initial measurable health improvements. After 20 weeks, continue indefinitely to maintain your health improvements and prevent future decline. I want to share another patient story because it reveals something remarkable about how one leaf can support multiple body systems simultaneously. Margaret, 68 years old, a retired teacher from Boston who had been diagnosed with osteoporosis and was terrified of fracturing a bone, came to me asking if anything could strengthen her bones without pharmaceutical medications. Additionally, she mentioned she had been experiencing memory problems and her cardiologist had warned her about early cardiovascular disease. We implemented the daily kale protocol. 1 to 2 cups of fresh kale daily, prepared however Margaret preferred, every single day. At her 8-week follow-up, Margaret reported she felt stronger. Her energy had improved. At her 12-week follow-up, her bone health markers had improved. Her memory had improved noticeably. Her cardiovascular markers had improved. At her 20-week follow-up, Margaret's transformation was comprehensive. Her bone mineral density had increased significantly. Her osteoporosis risk had decreased. Her memory had returned to normal levels. Her cardiovascular health markers had improved dramatically. Margaret felt strong and resilient again. Now, here is critical information that most people do not understand. The benefits of kale are cumulative. Each day of consumption strengthens your bones a little more, protects your brain a little more, supports your cardiovascular health a little more. Over weeks and months, these daily improvements accumulate into dramatic systemic health transformation. The benefits continue as long as you maintain daily kale consumption. For you, the implementation starting today is straightforward. Purchase fresh kale today. Beginning today, consume 1 to 2 cups of fresh kale daily, prepared however you prefer. Consume it with a fat-containing food for maximum absorption. Perform this protocol every single day. Keep a detailed record. Note your energy levels, your bone health feelings, your memory and cognitive function, your cardiovascular symptoms, your overall sense of health and resilience. Most people notice improvements in energy within 1 to 2 weeks. By 1 week, you may feel more vital. By 2 weeks, energy improvements are often noticeable. By 4 weeks, bone health markers often improve. Memory and cognitive function often improve. Cardiovascular markers often improve. By 8 weeks, improvements are obvious across all 3 systems. By 12 weeks, dramatic improvements are typical. By 20 weeks, comprehensive systemic health transformation is often evident. Let me tell you what I observe in my practice again and again when patients commit to this protocol. Within 1 week, energy levels often improve. By 2 weeks, patients report feeling stronger. By 4 weeks, bone health markers improve measurably. Memory improves noticeably. Cardiovascular markers improve. By 8 weeks, improvements across all 3 systems are obvious. Patients report feeling more resilient physically and mentally. By 12 weeks, dramatic improvements are evident. Bone strength is noticeably improved. Memory and cognitive function are significantly better. Cardiovascular health is noticeably improved. By 20 weeks, comprehensive health transformation is often extraordinary. Patients report feeling stronger, sharper mentally, and healthier overall than they felt years earlier. The science behind this is irrefutable. Your bones are not irreversibly declining. Your brain is not permanently vulnerable to cognitive decline. Your heart is not permanently weakened. All 3 systems retain the capacity to regenerate and strengthen when given the proper nutritional signals through daily kale consumption. This is not theory. This is measurable nutritional science. This is reproducible. This costs less than $2 per week. This is available to you starting today. The question is not whether this works. The question is whether you are willing to consume 1 simple leaf every single day for 20 weeks to strengthen your bones, protect your brain, and support your cardiovascular health simultaneously. I want to hear from you. In the comments below, tell me, what body system concerns you most after age 60? Is it your bones, your brain, your heart? Are you willing to commit to daily kale consumption to support all 3 systems simultaneously? Your answer helps me create content that serves you. If this video has given you something valuable today, please hit the like button, subscribe so you do not miss what is coming next, and share this with one person over 60 who is concerned about bone loss, cognitive decline, or heart health and deserves to know that one simple leaf could support all three of these critical systems simultaneously. Your bones are waiting to be strengthened. Your brain is waiting to be protected. Your heart is waiting to be supported. Make this choice today. I genuinely wish you a long, vital, strong-boned, sharp-minded, and healthy-hearted life. I will see you in the next one.